us. I have the honor of presenting Dr. PK today. Dr. PK is an associate professor of medicine at Mahidol University in Thailand. She specializes in infectious diseases and also serves as instructor and deputy head of international relations within the Department of Medicine. She is trained in internal medicine and subspecialized in infectious diseases. Additionally, she also has an advanced training in infectious disease pharmacotherapy as a research fellow at the Center for Anti-Infective Research and Development in Hartford, Connecticut, USA. Her research and clinical interests focus on pharmacokinetics and pharmacodynamics of antibiotics, drug-resistant bacteria, antimicrobial stewardship, and medical education. Please join me in welcoming Dr. PK.
Thank you so much for your kind introduction. Before I start today, I have one of our someone sent me a crap. Okay, thank you so much. Today we have one more from our faculty. His name is Associate Professor Ratthapol Tong. He is a Deputy Dean of Student Affairs and also Thailand Medical Council Board member. Because now we have spread our discovery year from UCLA around our faculty. Dr. Ratthapol, can you introduce yourself for a short?
Oh yeah. Thank you so much for your introduction. I'm UCLA alumni. I
Oh,
trained about
really?
hair disorder and hair transplantation there around nearly 15 years ago with Dr. Michael Colonne, but now he moved to the other university. But I'm still be UCLA alumni. Welcome. Thank you.
Thank you so much. So I'm gonna have to share my slide to bring all of you to understand the discovery year that we have a partner together. Okay, do you see my slide?
Yes.
Okay, thank you. So this is just the first slide to show our hospital. Our hospital exactly beautiful like this. If you see like a bird eye view, but if inside you will get frustrated and get lost because it's too many buildings. Okay, this is a hospital that has like 2,300 beds. So if you would like to do any research, we have many kind of research for welcoming students from UCLA. And go to my infectious diseases. I will brief a little bit for my division. We have three missions: service, education, and research. And this is our connection with a university. It should be University of UCLA, University of California, right? And we have long time ago. Can you see Dr. Tim Shak here? And Dr. Lisa Hoffman, that is very like 2004. Since then, we have overseas conference 3 or 4 times a year, and we accept elective from UCLA more than 10 to 15 people to be here. And to go to discovery year, it is already 3 years already, right, Dr. Tracy? It's already 3 years. Okay.
Yeah.
And I am sorry that I cannot remember which track belongs to the discovery year because it had many tracks, right? Someone just do small things, someone do something that take like 1 or 2 months, but someone like Anna, I hope Anna is here today to let you know how was the experience. So because we have service, education, and research, so we have many things for you to see and experience. And this is our consultation. I mean all the patient, non-medical and medical. So we have many patients to be get involved in our research, any research. And this is what we have done. Not just the normal service, we also have antimicrobial stewardship. That means we have this kind of research as well. And we have our own laboratory. We can do a diagnosis and service and research. And because of very innovative laboratory. So if you interested in laboratory research, you will be fine here. And this is the research and publication of our division. Like you see here, it's more than 50, 40 per year. So you will be one of us if you choose to be with us to do the research. And this is what we have done. The first time that I give a talk with you is a new chapter, but now is the new and now chapter of discovery here, because we already work with UCLA medical student and we have very, very good impression. At first, we start with a small project, not this one. We start with a small project because Ellis Gao in this picture, she cannot come to Thailand at that time. I don't know what is this called, the Dr. Tracy, to do just
Yeah,
only
she was participated in the concentration as an
concentration.
MS1.
Okay,
So
thank you.
Yeah.
Thank you so much. And she did a good job on the case report. However, this is not published yet because after this we decided to do 10-year review of the BCG septicemia. So she will have more than case report, but case series from Thailand as well. And after that, this year, since 2000, since June, I have been to UCLA and met a medical student, and we have one choose us, and that is Anna. Anna is here or not? Is Anna? Oh, okay.
Hi, yes, I'm here.
You're here. Welcome, Anna. So at first, we talked with Anna, and Anna interesting in the research that about social and behavioral research. And she will do the prevalence and correlation of mental health problems among older adults living with HIV attending at University Hospital, that means my hospital, Thailand. So we start to discuss and talk since July to August to do the proposal development. And we have a advisor from Sirirat Hospital, that myself and Dr. Kantrida. And the other two advisor from UCLA site. We did the Zoom meeting, like at first we did every 2 weeks, and after that we did every three days, right? Or every week until we got done with every IRB document preparation, and we are going to submission this month. And the IRB approve will be done by the end of this year. And next year, Anna will come to Sirirat Hospital and stay with us to do questionnaire-based research and also interview our patient. Even our patient is speaking Thai language, but true advisor will be with Anna to help her to interview the patient through these 4 months, and she will learn to do the results analysis with our professor of statistics. And after that, after Anna go back to UCLA, we will still do the manuscript preparation and maybe presentation at anywhere. So for now, you have seen that we have a small project, and this I think is a large project for us. I would like to ask Anna to let everyone know about something that she already experienced.
Hi, yes, thank you, Dr. PK. Hello, everyone. I'm Anna. I'm a current MS3. I just want to say that it's been really, really wonderful working with Dr. PK and my other PI, Dr. Contarita. From the start, they've been very flexible, but also really invested, I think, in their students' education and career development. And so I think this is a great option. For discovery or research involvement. If you are looking for a mentor who's really invested in your success, essentially, I think throughout this whole process, Dr. PK and Dr. Contarita have worked with me through every single part of the ideation process, the IRB preparation process, and they've been very detail oriented. And I think it's been a wonderful experience driving this project and making sure that things move forward. I think that if anyone is interested, I would highly recommend considering this as one of your discovery year options. And if anyone has any questions, you can feel free to reach out to me as well. I'll put my email in the chat.
Thank you so much, Anna, and we are very happy to work with Anna. She is very enthusiastic and she worked so hard because she is already like a clerkship on her surgical or something, and she usually work with us like very late of every day that we would like to talk. So it depends on you if you interested in any science. It's not just ID or infectious disease, but because I am an infectious diseases specialist, so I know what is going on in my division. However, like I told you that for now, everyone in Civil Hospital, especially the policymaker like a dean, associate dean, deputy dean, they all know that we have this program. So the associated, the deputy dean of research, he's know about this project and he will support and provide other sides of research. If you would like to contact with surgeon, if you would like to contact with OBGYN, pediatric, every single thing we can help you, including Dr. Latapon. He know every
Welcome.
yeah, he know every medical student. And we are going to have a new curriculum of international medical school that will happen in next 2 years. So I think this is the opportunity to blend it together. So for the next year, I have one project in ID if you're interested in, but it's gonna be different from Anna because this is gonna be laboratory research based. We will do about the drug resistant of Pseudomonas aeruginosa because it had like a problematic worldwide and especially in Thailand, including our hospital. I already showed this research, but no one interested in, and I changed to her interesting research, and it's okay, everything is fine. But I just want to show you that this is all the antimicrobial that we will do in the laboratory and in this research. And it will take like not so long like Anna research. Okay. Let me show you the timeline. So when you come here, you will participate in all of this part, do the research, do the laboratory research about isolation. You will understand entire process of how to do broth microdilution, how to do the MIC concentration test, and this is the most important, how to do the synergy test. This is the one that I prepare for someone that already interested in infectious disease. And this is all the agents that we will test in this project. But we will not start until anyone from UCLA choose this research. I will wait until the end of next year, December of 2026. But if no one interested in, I will start it on our own. So it should be like this 1 month because we already have the idea. If someone choose to do this, we have 1 month, 1 or 2 months to prepare the proposal to submit. And then you can choose to come here like Anna at any time of the year. Next year after June because that is after done with Anna research. It is just the brief timeline. We can modify and change it a little bit. And this is just a example. And I would like to ask Dr. Tracy, if I didn't cover anything, can you please complete it for me?
No, I think you've covered everything. I put a few notes in the chat just to kind of fill in the pieces on the partnership and the fact that we have students coming here, fellows coming to UCLA, students coming for clinical rotations, and this is probably one of our strongest partnerships in terms of trainees and faculty going back and forth and collaborating together. One thing that we are trying to get students to do, whether they're doing the concentration or whether they're participating in the discovery year as a pathway student, is joining the project that you're proposing, that you feel excited about and passionate about, part of the work that you're already doing, versus proposing a different project. I know you've been trying to find somebody to work on this one for a while now, and it would be amazing if the interest aligned. This is a really big class of first-year students, and it's a very small percentage that participate in the discovery year with the global health program. But I'm really hoping that you can find a student that can help push this particular project ahead, because I know you've been wanting to work on it for a while. I see that Dr. Radapon has his hand up.
Yeah.
Sure, I would like to add a little bit more about 2 points. First is when will you come, please inform me. I will prepare the dormitory for you if you want to stay. And the second, I will prepare some travel time and good food for you. Okay, I will let you to try Thai food and local food. Okay, thank you. 2 points.
So many students will choose us. So thank you so much, because when we work like a team like this, many people will come to taking care of you, and you will have more than just work and work research. You can participate in any part of Sirirat Hospital that you would like to see. Sometime when some UCLA student come here, they would like to do ID clinical rotation, but they also interested in something else like a geriatric. We can bring you to another hospital that taking care of geriatric, something like that, just one day, and that can be one part of our research project discovery year as well. And so I will email you and CC Dr. Ratapon about the dormitory, so it may
Please, welcome.
it may save your cost. So thank you, Dr. Ratapon.
Yes.
So for now, we are happy to have to take any question.
Okay. I wanted to ask you, Dr. PK, what inspired you to go into infectious diseases?
Oh, honestly, at first I really love hematology. I would like to be a hematologist, and I would like to do the transplantation, something like that. But after I taking care of the hematologic malignancy patient and transplantation, I think the most important, more than just transplant, is to treat infectious disease and save life. And to be an infectious disease, you have to be very, very talent medicine doctor as well, because we have to tell that this is an infectious disease or this is not infectious disease, and you have to tell that what is it. So that's why I love to do the infectious disease. Thank you for that question. Are you interested in?
I have a general interest in infectious diseases.
Oh, perfect. Thank you.
And Anna, and you can also come to see some like infectious dermatology in infectious dermatology disorder in our department. Welcome.
Thank you so
We
much.
have some like a granuloma clinic that is a typical microbacterium and deep fungal infection. many of them.
Yeah.
Welcome.
Dr. PK, can you
Mhm.
explain a little bit how you work with the microbiology labs and ID at Sirat Hospital? I think that's something that's super unique.
Okay.
We
Thank
don't
you.
have that relationship. Yeah.
Thank you so much. Dr. Tracy know every single thing of Sirat Hospital. So in our hospital, we have like more than 10 years collaboration with microbiology department. That is a big, big, huge and largest microbiology department in Thailand. Not our lab. Our lab is a research and small service that so we have clinical collaboration with the microbiology department. That means when we have a clinical service and we need something else, like we need very fast to identify all the organism, or we will have to have the knowledge how the laboratory identify the organism or susceptibility. So we have 3 times a week that we call clinical microbiology laboratory round. We will send the short patient profile to microbiologist specialist, and they will prepare the plate, conventional laboratory and also the automated laboratory to show us and to blend it together. So the microbiologist will more and more know about the patient and clinical, and we know more and more, and we work faster and faster with treatment of the patient. And that is the one that every UCLA people that come visit us love it, because 3 times a week. And I think at UCLA you use like a outsourced laboratory. You don't have something like go to the lab.
Thank you for that. Yeah, it's definitely really unique and is a highlight of the clinical experience for the students that participate in clinical rotations.
So I think maybe someone didn't have their own question for today because they have to think about it later. They need time to think, oh, what I should do and what I interested in. So it may take 2, 3, 4 weeks. However, I will visit UCLA in next June, like last time that we can talk with Anna when I was there. And please feel free to send me any email. I think Dr. Tracy has my email, and I can
Yeah,
put, yeah,
I can put your email in the chat just so everybody
sure.
here has it as
Yeah,
well. But I also wanted to just to add that that's something that is quite unique because Dr. PK is, you know, a world-renowned researcher and is participating in a lot of conferences throughout the US and around the world, actually. She is able to visit us here at UCLA just about once a year these days. It didn't used to be quite as often, but pretty regularly. And I think it is a great opportunity to meet with her face to face and learn a little bit about her interest and how she works with students and her mentoring style. I can say, you know, not from personal experience, but just from conversations with people that she has mentored and seeing her interact with her mentees. She is a phenomenal teacher
you.
and mentor. I think you even, I know you're very passionate about medical education, but I think you teach bedside patient interactions and things like that as well. So, you know, you really bring a unique, you know, skill set to medical education and to global health education. I really admire Dr. PK for that.
Oh, thank you. That is beautiful words for me. So it's like a non-technical skill, and we need it more and more because nowadays our students use too much AI. And AI always, like a chat GPT, always please you, but not please the patient. So just make it balanced. And I would like to be teach my students more and more, even UCLA people. So thank you for that. It's so beautiful and touched my heart. Thank you. And if anyone has only topic or interesting issue but didn't know how to go to the detail, please feel free to send me the email. And I use Yahoo email because it's very easy for me to get in touch with everyone. Formal email like faculty email is very hard for me to use it.
Dr. PK, I wanted to ask you if, for anyone in here who might be interested in infectious diseases, what is some advice you would have for us
But
in medical school? For any students who are interested in infectious diseases.
to prepare yourself or to okay. So someone that I met, my colleagues, they love in my microorganism since they were the medical student, but I'm not because I would like to see every single thing at first, and before to be an infectious diseases, I wish you interesting in medicine, internal medicine first, because the internal medicine is root of infectious disease. If you want to be an infectious diseases that very expert and understand every single thing or have like idea to understand the disease, you have to be the best internal medicine as well. I think you can prepare yourself and think about stay with it for lifelong. But I think that culture of infectious diseases people is about teaching. It's about research as well. If someone have the chance to meet Dr. Timchak, Professor Timchak that is infectious diseases, or Professor Joanna that is transplantation infectious diseases, they are all the best mentor I ever met before. They teach like us. They has like same philosophy of teaching like me. So I appreciate that they teach to think, they teach to realize the patient clinical presentation first, laboratory later, something like that. However, I think when you do something, you cannot just, oh, we are good in infectious diseases. Someone need incentive or salary or income. And I can guarantee that the poorest doctor in this world is infectious disease doctor. Poorest for the doctor, but not poor. You know what I mean, right? I still have money to come to USA. So I know I answer your question, but I would like you to explore every single thing before you decided to be anything.
Thank you.
Well, we're waiting for any other student questions. Dr. Ratapon has his hand up. You'd like to ask a
Okay.
question?
May I ask Anna, is this your first time to Bangkok, to Thailand, or not?
First time.
For
Your
me,
first time.
no, it's not my first time to
Mhm.
Bangkok or Thailand.
Okay. Thank you.
But if it is anyone else's first time and they would be interested in this project, feel free to share anything you'd like. Do you have any recommendations?
Okay. Uh, because of we will prepare the something for you like the about the vacation or any schedule for you if we depend on your the former experience in Bangkok. Okay, thank you. Welcome.
Yeah, one thing that has always been really nice about our colleagues in Bangkok and Thailand is that I think most people really aspire to work-life balance, and everybody works really hard and are very committed, but they also think it's important to enjoy life, and they have beautiful, beautiful places to visit, really delicious food, healing food. One thing that I, never really thought of before was the thoughtful medicinal effects of food and the herbs and spices and flavors that are used in Thai food that are actually connected to various health needs. And that is something that I wasn't aware of until I visited and participated both in a food tour and also was able to visit the Faculty of Traditional Thai Medicine and learn a little bit from them as well. So it really is a really unique place for learning about a lot of things, both work and pleasure.
And don't worry that it's very quiet now because every time it's like this. And someone go back home and think and then just pop up for something. Oh, okay. It's well, right?
Yes, I have it's a pretty broad question and thank you so much for coming to talk to us today. And there might not be one answer, but is there something in the infectious disease world that's kind of like the main research question or main issue that you guys are trying to figure out? Because I know that there's a lot of like antibiotic resistance questions, that type of stuff, but is there something that you see as the main issue?
Okay, thank you so much for this great question because it looked like all about antibiotic because I am interested in and specialist, but we have specialists like tropical medicine. We have specialists in fungus. We have specialists in transplantation. We have specialists in microbiology. We have specialists in virus and HIV. So it's not exactly the main each single one will have their own interesting so that I cannot answer exactly what is the main. However, we have something that like excellence center such as tuberculosis because we need it to be very like um, in the real world. We need to send the what is that called? When someone sent sputum culture for TB or any specimen for TB, and when it grew, we will go back to the physician as soon as possible. Something like that we call excellence center, and also the drug use evaluation, restricted drug, and antimicrobial stewardship. We make it excellence center. But if you interested in any kind of infectious diseases, I think we have like 12 staff that have their own interesting and expert in that part. And
That's
we
great.
now, and we now have a combined program training of transplantation fellows that from Thailand to be in UCLA 6 months and another 6 months to be in our hospital. And now they're both in UCLA. You can come find them and talk with them how it's going on. And I have to leave. It's okay, Anna. Thank you so much.
Thank you all so much.
Thanks for joining, Anna. Any other questions for Dr. PK? I did want to just plant the seed again. I referred to it in the beginning, but there's also the opportunity with the concentration to work with Dr. PK and colleagues, and they have projects that are ongoing, maybe passion projects, something where having a student support it that has a little bit of time to commit to it, that would be possible. So it doesn't have to be for the whole discovery year, although it would be wonderful to find somebody for the project that Dr. PK shared. Evelyn.
Hi, Dr. PK. Thank you so much for coming to speak with us today. Really appreciate your talk.
Thank
Um,
you.
I was wondering if your service or department has any research projects ongoing related to tropical infectious diseases or like neglected infectious diseases.
Okay, so now my head of the division, she is specialist of tropical medicine. So she work a lot of dengue. You know dengue virus, right? And also malaria. She has a going on of this kind of infectious disease. However, after the COVID era, she put more and more interesting in this kind of viral infection, tropical disease, and she is a. Do you know about the acquired immune deficiency syndrome that is is like a the patient that born normally but acquire the immune deficiency when they growing up like an adult, and they will get infection from bizarre disease or rare disease like NTM, and it's not very easy to treat. It's like a disseminated NTM, disseminated cryptococcosis, disseminated of salmonellosis, and recurrent all the time. Cannot stop the antibiotic, something like that. That patient may be like someone in your country that no immunocompromised, but got infected from cocci, and you didn't know why is that, something like that. But now we know in Thailand, in Taiwan, we know that is acquired immune deficiency syndrome, and she is expert for all that tropical disease.
All right, lovely. Thank you so much.
Thank you.
Dr. PK, I know we've been
Mhm.
talking mostly about infectious diseases, but I want to ask you a more lifestyle question. Like, what's your favorite thing about Thailand?
Oh, I think people in Thai, like every country, you have good person, bad person, that's normal. I think every country has something like that, but I can guarantee that Thai people, that good people, very nice. And one thing that they are, you will be feel like you are more than welcome all the time. It's not depend on what is your race, what is your color. Sorry about that, but it's exactly like that. Everyone will love you by like bottom of your heart because we are all human. Man and woman is equal, something like that. Everyone is equal. And when we saw someone that from another country, we said, oh, they may need help. And some even you look like, oh, what can we do and where we should go. Someone will go to talk with you with Thai language, but try to help you. So I think the most I love about Thailand is Thai people. And the second one is food and respect. We respect each other. Yes.
Thank you.
And if you done interesting in discovery here, you can come like elective. But I think the elective has like many competition to go to Sirirat Hospital.
Yeah, it is. It's very competitive because it's the most popular, choice of all of our clinical rotations. The students have such great experiences there, especially in the adult ID rotation, the pediatric ID rotation, and traditional Thai medicine. We get it's very, very competitive for sure. But we've just selected 5 students. Just this week, we finalized it that will participate in the rotation there this year. So
Okay.
just post match day.
Yeah.
I want to be respectful of your time. I know you're at the beginning of your workday. We're at the end. Final opportunity if anyone wants to ask a question. And if you don't have one, no worries. And if you want to reach out, I put Dr. PK's email in the chat. You can also, if for whatever reason you weren't able to grab that, because I know sometimes cutting and pasting doesn't work in Zoom, you can always reach out to me. I'm happy to connect any of the students. We're also recording this, so if you know that there's a student that's not here today, but that would be interested in the work that they're doing, please don't hesitate to tell them about it, and I can share the recording. And we're also just really grateful too that Dr. Ratapun joined us as well today. That was a nice surprise.
And thank you, Dr. Ratapon, because this is my strategy to help Anna or anyone to save cost about the accommodation. Thank you, Dr. Ratapon.
You're
This
welcome.
is my hidden agenda.
Yeah, you're always connecting. You're always working on this partnership. We really appreciate that. It's wonderful.
Thank you so much. And nice to see you again, Dr. Tracy.
Yeah, so nice to see you. It's always great to see you. And I just wanted to also thank Lois for
Thank you.
facilitating and coming with some great questions. They were really, you did an amazing job at that. So thank you so much for being part of this. So it's about 6:12 p.m. here. I know the students have had a very long day of classes. They're about to have exams next week, I believe. Am I right about
really?
that? Yeah, so next week is exams. So the fact that we had this great turnout is they're here for you because they're very much in exam mode right now.
Yeah. Good luck for your examination.
Thank you so much. So have a great day to our
Thank you.
colleagues in Bangkok, and to all the students, best of luck on your exams next week. We will see you in a couple of weeks.
Thank you, Dr.
Thank you so
PK.
much.
Thank you.
Thank you.